The North Carolina Council of Churches and the Partners in Health and Wholeness Initiative is really taking the opioid crisis seriously, and it's really important to us because we want to make sure the faith community is involved as much as possible in caring for folks who use drugs so that we can help reduce the overdose epidemic as well as the increased cases of HIV and hepatitis C and other things that go along with people who inject drugs. And then also making sure we're keeping them safe with distribution of naloxone.
Through a mini grant with Partners in Health and Wholeness, we've been able to purchase naloxone, the opioid overdose reversal medication, that we can then assemble into kits that go directly to Twin City Harm Reduction for them to give out to the participants. And we've used those, the naloxone in those kits as a vehicle to help educate our congregation and community more broadly about opioids, about substance use, about the war on people who use drugs, and about overdose reversal. The first batch of naloxone that we purchased, we had a Sunday morning where we put all of the naloxone on the altar and we prayed over and blessed it in a worship service. Took a moment for our folks in our congregation to lift up the names of people who had been lost to overdose. And then we had an educational service component where we got to talk about just the concepts of harm reduction, ask questions, share stories, and then put the kits together. Our aim is to help to dismantle stigma towards people who use drugs, help to understand the complex justice issues related to the war on drugs in our country, the racial issues related to the war on drugs, and to seek justice as a faith community in the many ways that shows up.
My main job is just to work with faith communities across the state. Whoever is interested in learning more and being more aware about the opioid response and harm reduction and nicotine or tobacco, empowering them to have talks in their community with their congregation, helping them figure out where they might fit in with one of these opioid mini grants. Make sure they have the information and the resources they need to be able to help their community and congregation.